Art has long been a form of self-expression and creativity. It holds both visual beauty and emotional power. In it, we can discover new ideas and deep insights into ourselves and others. Painters like Van Gogh, who suffered from depression, show us that a person's emotional state can be tied to the art they make. Emotions can be represented by colors, shapes, either consciously or subconsciously, that can help us understand feelings that are sometimes hard to describe. Creative therapies like music, dance, and art have recently been more accepted as legitimate ways to treat an array of mental and physical disorders. Art therapy is a type of psychotherapy that promotes mental and emotional well-being. Therapists use art media such as paint, colored pencils, and clay for their patients to show what they are feeling in a way that can sometimes be clearer than words. For therapists, this can give insights into the patient's thought processes and help in diagnosis and treatment. It allows patients to use the creative process to express themselves, as well as discover subconscious thoughts and feelings. Art therapy can aid in both diagnosing and treating a variety of mental illnesses such as anxiety and depression. It can also help patients with overcoming a range of physical illnesses, stress from traumatic experiences, addiction, and compulsive behavior. In a study of the effects of mandala art therapy, researchers found that psychiatric patients experienced positive psychological effects such as hopefulness, resilience, and well-being as a result of the therapy. Other examples of art therapy studies include how patients cope with failure and how art therapy can help cancer patients with hopelessness and fatigue. The goal of art therapy is to help the patient achieve mental stability, but it can also apply to other areas of a patient's health. Art therapy can help with fine motor skills, gross motor skills, and sensory awareness. It can also help patients to learn how to communicate what they are experiencing more effectively and further develop their self-awareness. Helping others to see the world in a more optimistic way is a goal of art therapy that can improve the quality of life for patients of all ages with many different cases.
In 2015, adult coloring books began popping up on store shelves all around the world. They even topped Amazon's charts as the #1 sold item. What was all the fuss about? As it turns out, coloring is one method of art therapy, and it can have great benefits in regards to relieving stress. The brain function used in coloring lowers the activity of the amygdala, an almond-shaped structure towards the center of the brain, which controls the emotions caused by stress. When these emotions are at bay, the apprehension is temporarily released. Research shows that art therapy can help with more than just stress, however. In 2016, a study was conducted among patients with advanced stage cancer. These patients learned mindfulness practices, such as meditation skills, in sessions taught by yoga specialists and clinical psychologists. Then they entered into a session where they were asked to paint their feelings. After the testing was complete, it was concluded that these patients experienced increased vigor, reduced fatigue, tension, depression, and confusion, and overall were regularly in a better mood. How can art therapy do all this? Besides the aforementioned sensation of lowering amygdala activity, when used as a means of therapy, art can tap into feelings and thoughts that words cannot sometimes. Take these drawings, for example. In this study, participants were asked to draw failure. As you can see, each perspective is drastically different and seems to have some personal context behind it that would not be revealed had the participants been asked to say what they thought failure was. Art therapists can use this concept to provide understanding and healing to patients they might not have been able to receive from typical talk therapy. An intensive, enduringly extensive, and replicable science of behavior is one where psychology joins hands with the arts, narratives, literature, and the humanities. After all, men, women, and children are entertained, experience emotional and intellectual excitement and stimulation not from the bland structures embedded in psychology, but rather by plays, ballet, the opera, music, poetry, novels, and narratives. It thus goes without saying that a sophisticated and efficient psychological science needs to embrace these venues of what it means to be human and what it takes to stir people emotionally and in a way to elicit behavior and decision-making.
Passion is crucial to art therapy in the sense that people are more comfortable with opening up when they care about what they're doing. Passion provides motivation and familiarity to a study. Self-expression and perspective play major roles in the success of art therapy. Art therapy is beneficial to psychological research and treatment by unlocking a subject's subconscious. This leads to more truthful responses and a more genuine outcome in comparison to traditional psychological studies. The familiarity of the arts allows for the comfort and peace of mind of the subject. Art therapy relates to the thought process by unlocking the subconscious. As previously mentioned, the failure drawings revealed the patient's perspective of their personal depiction of failure. Art therapy allows for patients to think freely and liberate suppressed emotions. Art therapy is believed to be a window into one's perspective. Art therapy affects the brain by utilizing the familiarity of the creative thinking process. Memories and fondness of a particular art have proven to be more effective than traditional studies used today. Art therapy is considered to be the old method of coping with unwanted thoughts and feelings. Art therapists believed it is essential. Art therapy is essential to revealing a subject's true emotions. Art therapy has also proved to expose behaviors a simple study never could. This is thanks to the lack of passion that a typical study would have. Art therapy is beneficial to psychology because of its implementation of passions and creativity to treatment. Art therapy strays from psychology's narrow box of hobbies and desires. Again, this proves to be the more efficient route of research and treatment. Robert Perloff, former president of the American Psychological Association, implores psychologists to embrace artistic culture and remedies in their research endeavors. In 2002, a study found that art even relates to the way in which humans choose their love mates and interests. Last but not least, art therapy respects a wide range of passions, therefore reaching a larger demographic of people who can benefit from it. Art therapy has the potential to be the turning point of psychiatric treatment and therapy. Its blend of passion and creative thinking allows for it to be beneficial to everyone and give professionals a deeper look into the subject's mind and subconscious. So what we're going to do is we're going to draw what we feel like our soul or aura looks like, and a lot of times art therapy really helps with people finding out what they are in the inside and what they maybe even feelings that they didn't know they had. And so we're going to go ahead and try drawing what we believe our soul looks like. What is your soul? What do you feel like your soul looks like?
I felt that it looked like a swirl of sparkling energy.
That's really good.
What's your soul?
Mine, I drew it as something that like consumes my whole body. Like it's kind of more. Mine's more like an aura, I guess, than a soul because there's my little heart, and then from the inside just going out like my feelings and who I am. Just kind of sappy, but that's what art therapy is supposed to do. It's supposed to show you things that you didn't know before about yourself. There's my little soul.